Greetings, I'm Doug Schwinn. This video will go over the fourth step of the MARCH-E algorithm, circulation. The C in MARCH-E is for circulation. This part of the algorithm is to ensure major bleeding is still controlled and minor or inconsequential bleeding is addressed and bandaged. After bleeding is controlled, intravenous or intraosseous access is gained in order to begin fluid administration and treatment for shock. Additionally, this part of the algorithm lends itself to reassessment of tourniquet placement. The high and tight application may be converted or approximated depending on the patient's vital signs and suitability for such. Circulation guidelines. Reassess every tourniquet or bandage applied earlier. Expose the wound and determine if the tourniquet is controlling the bleeding. During reassessment, if a tourniquet needs to be repositioned, remove sufficient clothing material to place another tourniquet directly to the skin and tighten. Ensure that bleeding is stopped. If there is no traumatic amputation, check for pulses distal from the tourniquet. If bleeding persists or distal pulse is still present, consider additional tightening of the tourniquet. Or, place a second tourniquet side by side with the first to eliminate both the bleeding and the distal pulse. Hemorrhagic shock. Quick, effective treatment for shock is imperative to patient outcome in traumatic situations. Fast, reliable, low-tech way to recognize shock in the field is traumatic mechanism of injury, or MOI, decreased state of consciousness with trauma or blood loss, assuming the casualty has not suffered a head injury, and abnormal radial pulse, either weak or absent. After assessing for hemorrhagic shock through altered mental status in the absence of a brain injury or weak or absent radial pulses, if the casualty is not in shock, no IV fluids are immediately necessary. Fluids by mouth are permissible if the casualty is conscious and can swallow. If the casualty is in shock or develops shock, follow your system's protocols for fluid resuscitation. Casualty not in shock. If the casualty is not in shock, any abnormality in mental status may be due to some cause other than blood loss. Fluid resuscitation is not needed if blood loss is minimal and does not threaten the casualty's life. If the casualty develops shock due to internal bleeding, follow your system's protocols for fluid resuscitation. You just saw the slideshow on circulation. I would like to highlight the following points regarding a traumatic patient in the pre-hospital setting. First is tourniquets and bandages. It's incredibly important to reassess your tourniquets and bandages anytime there's a change in the patient. Second, check for shock. A low-tech way to check for shock in the field is mechanism of injury, so the traumatic situation that the patient requires services for, loss of consciousness or altered mental status, assuming there's no head injury, and an abnormal pulse. This could be weak and thready or absent. When we come across these findings in reassessing the patient, it's important to think about hemorrhagic shock and whatever your EMS protocols are for treating such. This concludes the fourth step in the MARCH-E algorithm.